Hello, everyone. Good to see you all again. I'm Sang-Chul, private practitioner, periodontist. I welcome everyone to Dentium Live Surgery Show. I appreciate all the people across the globe for giving much attention to these monthly live surgery shows. With all your support, we are holding two different live surgery shows this October. Taking the first live surgery, I'm very honored to join this as a moderator. Today, we have Dr. Jung with us. He is showing us the simple approach to sinus augmentation. Furthermore, he will introduce a new implant system. I hope this live surgery will upgrade your clinical skills and help your own practice. If you have any questions, send us anytime during surgery. It will be replied. Thanks. Okay, let's take a look at today's case. Okay, today's case, the title is a simple approach to implant placement and sinus lifting. And about the patient information, 69, male patient. His chief complaint was, I have an uncomfortable feeling when I use a denture. I can't taste it when I eat something. His past medical history, have a hypertension, take aspirin. Okay, about the surgery plan, upper right molar area, implant placement using tissue level fixture will be placed on number 14, 15, 16, or number 14, 15, 17. So today, a surgical stand will be prepared for all of these areas, 4 holes, including 4 holes using digital guide. About 20 areas, surgery plan, upper left molar area, he will be sinus lifting with crestal approach by Dr. Jung, and also number 26, 27, implant placement using bone level fixture. The maybe brand new system will be introduced and applied today's surgery. And also he will be bone grafting on the buccal area, and also crestal approach, bone grafting, including the bone grafting. About the panoramic view, as you can see, actually a vertical bone, remnant bone level is very nice, especially right upper area is enough vertical bone volume, and about the left area, maybe slightly constriction, about 26 area, but it is not so difficult the situation for the crestal approach, as you can see. So both of maxillary sinus lifting or just placement fixtures will be placed very faster. About the CT scan, as you can see, number 14 area, very nice, wide bone volume, and also have a enough vertical bone volume. And mucous membrane is intact, slightly thickened, but is not it is not no problem. And about number 15 area, as you can see, it's also good situation for just the simple implant placement. Just a little bit, maybe a shorter implant is good, but if you want to place a longer in this kind of case, maybe slightly osteotome, need osteotome, or crestal approach instrument. What about number 16 area? Slightly reduced compared to previous one, number 15 and number 14 area, but it is good for the implant placement. But vertical bone volume is smallest compared to another neighbor area. And number 17 area also good vertical bone volume, the thicker mucous membrane situation, as you can see. In this case, maybe simple implantation with bone grafting is a necessary part and enough to proper implant placement with a digital guide. And let's move to another part, number 26 area, maybe a typical sinus, the lifting situation, right? So around the vertical bone volume is maybe 6-7 millimeter, but the wide remnant of the bone width. So it is good indication for a crestal approach. And about 27. What about this one? Can you see the big arteries, lateral wall, inside of lateral wall, and thickened mucous membrane? And so in this kind of case, very typical indication for crestal approach, as you know. So this one is initial photo when the patient first visit to come the dental clinic with he wear removable partial denture looks like here. Okay, so he wear the removable partial denture. So he don't want removable partial denture anymore. So he want to decide to have implant placement, implant surgery. So this one is initial photo, intraoral photo of his patient. And the upper right maxillary area may be slightly not perfect soft tissue healing, but it is enough to have live surgery. Okay, so both maxillary areas are healing situation, right? Okay, let's move to a CT scan. As you can see, number 14 area is the enough vertical bone volume and also a wider alveolar ridge, wide alveolar ridge. So the treatment plan is 4.57 millimeter on number 14 and 5.07 millimeter number 15. The same as on number 16 or number 17. It depends on bone situation and bone qualities. Maybe Dr. Jung, after incision, he check the bone qualities and bone morphologies, and then he will decide which one is better position for implant placement, right? So he will try no suture technique. Incision will be done, but he don't want suture, so just leave it, and we can see very nice and wonderful situation after this kind of new technique. So number 16 and number 17 is typical situation for the sinus surgery, but how could Dr. Jung overcome this kind of situation with a simpler method combined with the brand new system, right? Okay. So this one is similar case using digital guide without the suture, right? The healing photos, as you can see, very nice. The automatically natural healing, and then the final lacerations. Okay, let's move to surgery room cause of patient already prepared, and then Dr. Jung want to start today's surgery. So remnant of information of this patient, intraoral situation or some CT scan will be supplied during any time during the surgery. At any time during the surgery, right? Okay, thank you.
And we have already the pilot drilling. So as you already know, after extractions, labial bone will be collapsed and also loss of the keratinoid tissue on the labial side. So at the time of the pilot rolling, and if you do pleural surgery, at that time, so margin of the crown will be almost very close to the mucogingival junction. And also the crown length on the labial side it became to be much more longer compared to the palate side. So
Right.
to compensate of them, and within the bone defect less than 3 millimeters,
Yeah, Dr.
we
Jung
tried to
got already
little bit
a
2 or 3
pilot drill
millimeters
for the
ringolize the
proper
incisions
the position using
to
distal guide
compensate the
and then assessment
labial
about the
defect.
position.
So
So
I will try after the pilot drilling, we can see the implant position. So I will make your flap design 2 or
after
3
pilot
millimeters
drilling,
palate side
he
to the
assessment
pilot drilling side.
he assessed the position
So I will start your initial
of distal
drilling.
guide and implant future implant placement area. So he have decided
2 or 3
make
millimeters
incision instead of flapless
palate
surgery,
side.
right?
So a little bit beveled to the alveolar crest. And sometimes we can do clear cut, but
Yeah, he
sometimes
make
we cannot do clear cut, depending on the bone architecture.
the paracrestal incision, a slightly palatally deviated incision was done, as you can
After
see.
that,
So
after the design of the flap
making a
design,
clear
we
cut
tried
using this
to confirm
periodontal
of the
curette.
incisions, clear cut. We'll do
Actually, he
additional
really loved these
incisions,
periodontal
incision
curette
to the
and explorer.
periosteum.
When he want to make
We do a Kirkland knife or door,
the double checking,
knife.
the clear cut about
not to tear
this
the flap,
kind of surgery
2 or 3
situation
times
when you have
to
initial
confirm the clear cut to the periosteum.
incision. So always he
After
want to
that,
use, prefer to
retraction.
use like this surgical
The incision line,
the
pilot
periodontal
ring side.
curette and explorer, and then now he is using
입술이 아프시죠? 어디가 아프셨어요? 입술이 아프셨어요?
아, 그 인중하고요.
수술 부위,
인중하고.
수술 부위 잇몸이요.
예, 인중하고요.
많이 그럼 조금만 더 할까? 이거 제낄 때 아프셨어요, 선생님? 이게 아프셨어요?
얼굴 찌르는 것 같아요.
여기가
okay.
마취를
He's
좀
checking the
좀
flap,
더 하겠습니다.
and
지금
the patient
아프세요?
need more
지금 괜찮으시죠?
numbness. So actually, the Dr. Jung make a patient a little bit more numb. So
할게요.
give an anesthetic solution,
감각은 없으시죠?
make an anesthesia a little bit more.
마취를
So
사실은 좀 2배를 했었거든요, 이미.
additional injection for comfortable surgery situation.
15번 블레이드.
Okay.
이쪽을 조금만 더 절개를 연장합시다. 그렇게 아프지 않으실 거예요. 이미 마취가 이제 지금 한 3배
Okay.
됐거든요.
He made the vertical incision for flap retraction using small round multicurette,
됐습니다.
flap reflected.
And I will
So
milling surgical stand.
yeah,
With
he
the printing
today he is using the milling surgical stand instead of 3D printing. What is big difference between 3D printing surgical stand and the milling stand? Actually, this milling stand is stronger than a 3D printing.
drilling, we little bit positioned the tip of the drills to the palatal side and push the gingiva to the labial side.
Okay,
예,
so
좋아요. 예.
he pushed the labial flap using this drill tip, and then go inside to the alveolar ridge, right? So it is his tip to reflect the vertical, the labial flap reflection during a drill. Now he has used the slower
잘 되고 있습니다.
RPM, like almost 50 RPM. The Dr. Jung really loved slow drilling,
미리로 이것도 속도가
about 50 RPM. Okay, can you see the slow drilling situation? So ordinary guided surgery introduced by company higher speed drilling like 1000 or 1200 RPM drill with saline irrigation. But this time Dr. Jung used slow RPM 50. Okay, so now drill 3.3 9 millimeter. Okay. Very nice. Yeah. Keep going. Keep going. Okay.
5.0은 first molar. I will press the diameter length is 7 millimeters many, and also in the premolar areas, we press the diameter will be 4.5, and the molar side is the diameter is 5.0.
Oh, you have decided about the implant fixtures size, the diameter 4.5, 15, number 14 and 15, and then about number 16 area, he want to use the 5.0 diameter implant fixture.
거의 다 오른쪽은 거의 다 끝나갑니다.
Yeah, so
감사합니다, 선생님.
number 14, 15, 16, 3 site is preparing for implant placement. Actually, this upper right area decided by Dr. Jung about the bicortical engagement without the sinus lifting, right? So 7 millimeter length,
잘 됐어요.
yeah, 7 millimeter length, no, yeah, no sinus lifting, just 7 millimeter. It is not involved to sinus cavities cause of a shorter length, 7 millimeter. So Dr. Jung's concept is here. The diameter of fixture can be compensated by a shorter length of implant fixture. So even though the 7 millimeter, but the 5.0, 4.5 wider diameter can compensate this slightly shorter implant fixture, right? So total surface of implant fixture same as a smaller diameter, longer implant fixture.
The last one.
Last one. This implant system, a bright system, brand new, Dentium's brand new system. The system's name, bright system. This one is a tissue level implant fixture, right? So bright system have two different systems. One is bone level type, another one is tissue level type. Both of type can be available by only one surgical kit. So the aim of bright system is simple and easier. Simpler and easier is a motto of bright system. So as you can see, this tissue level implant very unique, right? So what is unique? Actually, this system, this tissue level system, basically external connection, right? External connection. The shape of this picture, top portion, is very similar. Picture with a screw abutment, right? So in other words, built-in screw abutment fixture system, right? So inclined external connection is a unique of the unique point of this bright tissue level system. Right now, connect with the healing abutment. Looks like here. Generally speaking, the many companies sell the tissue level implant today, but actually market share, the bigger market share, tissue level implant was an internal connection, like 8 degrees internal connection, like Straumann system. But today, we can see the unique, the bright system, tissue level system. This one is external connection, inclined external connection system. Very similar, looks like fixture connect with a screw abutment, right? So it is very unique point of bright system. So now he's trying to gave a more talking and connected the healing abutment right here. They're very simple as you can see. Just the initial drill and the final drill 2 or 3 times and then implant. And actually this system gave us a very strong initial stability compared to the previous one, like Analine or Supine system. So if you want to get the higher initial the stability when you have a softer bone, we have a surgery. So this bright system will be a very nice, very good choice for this situation. So Dr. Jung used this bright system, the posterior, the upper posterior area. As you know, this posterior, upper posterior molar areas, bone qualities, they're so soft, around type 3 or type 4, as you know. So this softer bone area is best indication for this bright system. Doesn't matter, tissue level, bone level doesn't matter. But this time, Dr. Jung chose this tissue level on right upper molar. I think he is going to place the implant on left upper molar area, maybe try to with the bone level implant fixture or bright system. Let's see. Okay, so just only 3 sutures. Yeah, surgery was done. Wow, very simple. So he chose.
Today's suture is minimalized.
Yeah, very extremely minimalized actually. Yeah. Just drill, fixed, and then suture. No bone augmentation, no sinus lifting, no the complicated surgery plan. Just a simple implant.
좀 어떠셨어요?
참을만 했어요.
아팠어요?
Because as you know, the tissue level implant gave us a lot of advantages compared to bone level implant in some cases. As you can see, basically this own nature of tissue level implant gave us a stronger connection. If the same diameter compared to the bone level implant as well, we can get the higher stability and connection stability also, right? It means the posterior molar area, if you choose this tissue level implant upright, maybe 3 point, even though the 3.5 can be covered on the molar area. Yeah, 4.0 is enough, but in some case 3.5 can be available for restore molar area, right? So it is a big benefit, big advantages. Okay, so he already moved, wrapped upper molar side. So a clear-cut flap incision and flap reflection. Okay. Yeah.
The bone is very good enough.
Yeah. Bone is enough. Bone is enough. As you can see, his crestal incision was done
At first, I will do 6
palatally
millimeter steps.
palatally deviated incision.
7 or 8 millimeters.
Yeah. Okay, so
6 millimeters.
the ordinary 2-point to palatally
7 is 약간
the deviated incision is
앞에는 7
the most general and popular
아,
crestal incision type
입술이.
of Dr. Jung.
죄송해요, 선생님.
Cause of this kind of crestal incision is gave us a benefit, easy to handle the palatal thick plaque. Okay, now he is starting to drilling 7 millimeter. Yeah, also 7 millimeter. Okay, yeah, the slower speed, with a slower speed without saline irrigation, just he want to try 7 millimeter drill. So he will he is going to 7 millimeter implant fixtures as well, right?
한 번만 더 할게요. 옳지.
Okay.
네, 고맙습니다. 선생님. 네, 됐어요.
Okay, very simple and easier system compared to previous one. As you can see, this system doesn't need countersink anymore, cause basically a straight type fixture. So, yeah, so just a straight drill and the fixture. That's it, right? So no countersink, no undersized drill, just drill the same size as implant fixture expected, and the put implant. That's it. Very simple. So he have already done the drilling on osteotomy side.
있어서 그게 터졌나 확인하기 위해서 코를 헝부를 거거든요. 코를 막고.
Yeah.
그래도 발음을 헝부를 없어요. 아니 그러지만 소리 입으로 말고 코로만 흥. 네, 됐습니다. 다시 한번 흥. 코로만. 코로만 살짝.
Yeah, Dr. Jung is checking
그쪽이면 코로 흥. 코로만.
the sinus, the floor of sinus.
다시 한번
Yeah.
코로만 살짝.
This 7 millimeter drill is almost the contact to sinus
잘
floor.
됐습니다, 선생님.
So now he
다시
is
한번
cross-checking
코로만 봐라, 흥.
the perforation or not. So
안 나오죠? 좋아요. 그래서 이제 크리스탈 드릴링을 또
yeah, so yeah, he is going to continue to crestal drilling for the crestal approach of sinus cavity, right? So
큰 거를 쓸 필요는
yeah, 7 millimeter drill already done. The contact to sinus floor. So just a little bit remove the sinus base, sinus floor, and then the detach of sinus membrane from the sinus floor, and then the bone grafting
이쪽은
and
보니까
fixture.
되네요. 뒤에는 어떤? 뒤에도
Okay.
난 이제 completely perforated to the
Oh.
sinus floor. So
Oh,
I
yeah,
will
still
grind
remaining of sinus floor.
Sinus crystal approaches.
Okay, so yeah, the desk drill.
그게 되는 잠깐만요.
This desk for sinus surgery is very well known, worldwide well known drill.
저희는 좀
Yeah. Every surgeon want to use this desk drill for sinus surgery. So this one is crestal drill. This marking line, the 2 millimeter incrementally. So 2, 4, 6, 8, right? So the head size 4 millimeter, 6 millimeter. It depends on the head size. You can choose each one either.
2mm만 더 하겠습니다.
So he is going to 2 millimeter into the sinus floor direction. So can you see this internal irrigation with the external irrigation? So Dr. Jung used this both irrigation using this metal tip for internal irrigation. This internal irrigation means the actually the meaning. It means dual benefits. First one is irrigation, the purpose. But another purpose may be hydraulic power for detaching of sinus membrane from the sinus cover, right? This internal irrigation, the saline power also working as the hydraulic power.
됐습니다. 2번으로 해서 이쪽도 간단히 끝날 것 같은데요.
Yeah.
한 번만 뎁스를 한번 더 확인해
Yeah, you wanna check? Oh, yeah, you wanna check? This drill, a universal drill in dentium, as you know, all the systems can be prepared with this drill for osteotomy, right? So Dr. Jung is checking the drill, a universal drill. Okay, so this hydraulic power is lots of benefit. Gave us a good benefit when we want to remove the sinus membrane from the floor or lateral wall. So if you want to use this crystal drill of desk kit, you have to use this the irrigation metal tip with the internal irrigation. Also you can use the hydraulic power with irrigation, dual function. Now, this picture, a bright system, brand new dentium system, bright, 5.0 diameter, 7 millimeter. As you can see, the strong enough stability, even though the softer bone looks like this kind of molar area. Molar area, the ordinary type 3, type 4 bone, softer bone area, as you know. But
So I will connect the drill extensions.
Yeah.
힘들어 하시는군요. 거의 다 끝났습니다.
so just the drill and implant placement, right? Okay, good.
됐네요. 힐링 오프먼트. 기준 거를 두 개.
Yeah, can you remember the supine user? For the supine user, generally speaking, of dentium company, supine user, if I, also including me, if you want have a higher initial stability when you have a softer bone like this sinus molar or premolar area, maybe the ordinary person want to make a smaller osteotomy, right? So underside drilling is a popular drilling technique. You can use also this underside drilling when you use this bright system, but the same side drill, it doesn't matter because of this bright system gave us a higher initial stability. So this internal connection of bright system is another big benefit. Yeah. What is another big benefit? It means the stronger connection, right? So 10-degree internal connection type and deeper connection, 2 millimeter deeper compared to previous one version. So strong enough connection with abutment and fixture inside. So even though internal connection type that it is impossible to think down, and also if you choose non-hex abutment, just the round abutment doesn't matter to stable connection. Yeah. So okay, he is starting to suture. Very unique suture. Looks like horizontal matrix, but modified. It is not the traditional type of horizontal matrix suture. It's modified. Dr. Jung's modified horizontal matrix suture type. And already one GBL pin fixed for fixation of the flap, right? Just behind second premolar area, right? So he didn't use bone grafting even though the crestal approach, because he have decided 7 millimeter shorter implant fixture. If he want to use 9 millimeter, maybe he did bone grafting into the sinus cavity after the desk kit, but now, okay, so just put implant fixture and connect with healing abutment and simple suture. That's it. Very simple surgery. Wow. So even though both sinus case actually the conventional style, the traditional conventional style, the surgery, maybe the crestal approach need more procedure, the drill or some osteotome, and then the separation of sinus membrane from the floor and bone grafting, and the slightly longer diameter insertion, slightly longer implant fixture insertion. The variously little bit more complicated procedure should be needed, right? But this the price system, the shortened and simplified all the procedure, even though this kind of a sinus involved area case, right? So, okay, so, right? Okay, so we will take the break, and then after 5 minutes, maybe we will have a Q&A session. Thank you for watching this live surgery show. Okay, so let's see this the post-op panoramic view. As you can see, very nice. The upper right molar area and also left upper molar area. Right molar area, premolar and molar, actually, as you can see, a tissue level implant, slightly the smaller diameter compared to left one. As you can see, 4.5 external connection type tissue level implant here. So number 14, 15, 16. Skip the 17. Cause of Dr. Jung have decided skip this number 17 area, cause of tooth cringing, and actually the hygienic effect. Cause of the ordinary elder person, it is very difficult to have the proper toothbrushing when we have second molar area implant fixture or some another restoration. So for the convenience of the hygienic the purpose, the implant placement on the number 14, 15, 16. And also left upper area, as you can see, internal connection type of brand new bright system was used. Number diameter 50 and the 7 millimeter. The slightly involved sinus cavities using this desk kit already. I already mentioned before, right? So the healing connect with the healing abutment. Very nice, well done, both sinus surgery. So after this one, the actually number 14 area he slightly deep insertion after taking this panoramic view cause of the leveling, right? So Dr. Jung have done this little bit more deep insertion after taking this panoramic view. So actually all the level, 3 implant fixed levels are same, right? So this left area slightly sinus cavities elevated by crystal approach, use the dust kit, right? So as I mentioned before, so very nice, well done. So actually today's surgery so simple and easier. I think in my thought, he couldn't, Dr. Jung couldn't finish this sinus surgery like this without a brand new system, right? So combine this brand new system, make easier and simpler when he have sinus surgery, both sinus of maxillary posterior area. So let me introduce briefly about this brand new bright system of Dentium, right? This bright system is a brand new system of Dentium company. This system have both dual level system. First one is tissue level, another one is bone level implant, as you know. First one, tissue level implant. As you can see, 6 different diameter is available, and the length is also from the 7, 9, 11, like an odd number increasing. So this unique system can be introduced. The key point is external connection type. Looks like external connection type. External connection type of tissue level. So generally speaking, all another system of other company gave us supply us a tissue level implant with the internal connection, like 8 degree, for example, 8 degree of Straumann system, like Straumann connection. But this Dentium tissue level implant brand new systems, the unique style, as you know, tissue level but external connection. The external sealing connection system have external hex. So it means stronger than the bone level implant, even though the same diameter, right? So the company introduced us did 3.5 smaller diameter tissue level implant with external connection. We can apply the molar area, right, upper molar. So it is like very the good news for, like a gospel for us. Actually, good news for us. Cause of lots of patient. Many patients have a restricted, smaller, narrow reach, especially upper molar or lower posterior area. So when we choose this kind of stronger, greater system, all the GBR procedures, including some the complicated bone grafting and also membrane application or other some difficult procedures, can be skipped, right? So just proper position with a digital guide with the 3.5 or 4.0, even though the posterior molar area, that's it. Just a small volume augmentation is enough. So strongly recommended this kind of tissue level external connection type, actually built-in screw abutment style, the unique design, this bright system. Okay. Oh, this one is a final panoramic view. After the leveling, Dr. Jung tried again for proper the positioning on number 14 area. So as you can see, as I mentioned before, all the 3 fixtures levels are same, right? Very nice, well done placement on the proper position. So yeah, very nice, yeah, and simple. No any other bone grafting substitute applied, right? So can you remember? Did you see all areas doesn't accept this bone substitute for some GBR. So this bright system gave us and gave Dr. Jung make easier and simpler procedure, even though on the posterior sinus involved area. So let me talk about the internal connection of a bright system. So this one is bone level. Actually, I flipped to explain about this system. Actually, sorry about that. I first explained about the tissue level first, and then now move to bone level implant. A bone level implant fixture have a 5 diameter, different diameter. The first one is 3.0 taper, and then 3.5, 4.0, 4.5, and 5.0. 5.0 is enough. Also, this kind of diameter can be used, lascu diameter implant fixture, right? So basically straight type and unique performance is here. This bright system have unique performance. What is unique performance? As you can see, 10-degree internal connection, right? So generally speaking, we called connection about the connection 11-degree, like Astra style, Astra system style, Astra style, right? So 8-degree Straumann style. Now 10-degree is Dentium style. 10-degree also belonging to the Dentium company. Dentium company developed using lots of data of R&D center. So they made finally 10-degree internal connection, right? This one is a very improved connection type, and also deeper insertion connection. As you can see, 3.7 millimeter deep connection. So it means higher, extremely stronger connection with the abutment. So no screw loosening, no sink down situation, no the fracture or something else, right? So all problems can be solved by use this 10-degree deeper connection system. So Dentium companies finally made this unique and stronger system. So this one is another good news for us as a user. So 3.7 deep connection, once again 10-degree gave us a stronger, higher stability, enough stronger connection with abutment. So no more worry about sink down or some screw loosening, even though screw fracture, fixture fracture, right? So this clinical or R&D data released to the user, we can see the 68% stronger contact surface area, higher contact surface area, wider contact surface, and broad contact surface, and the sink down extremely reduced compared to previous system, right? So, okay, let me introduce about another second live surgery show this October 23rd, Korean time 7 o'clock. Next live surgery show will be started. Thank you very much for watching this live surgery show. Thank you.